Well, good morning. I'm Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University and the Executive Director of the Tennessee Institute of Public Health, and it's a real pleasure to have the opportunity to talk with you today. I do apologize for not being there in person, but hopefully I can provide some information that will help guide and direct your discussions today. And of course, if you have any questions after this, please feel free to contact me at the contact information available at the end. I want to talk today a little bit about the issues that are important to you all as community leaders who want to improve health in your region, with a talk that I'll title Understanding and Improving Health in Tennessee. For purposes of today's talk, I'm going to focus on the 20-county area of West Tennessee. These are the counties, of course. Behind each county name is a number or a letter that will help you identify your counties in the charts that I'm going to show you in a little bit. But I want to make one very important point, and that is, while I'm talking about these 20 counties, the issues that I'm talking about are really true across the country and across the entire state of Tennessee. So if you happen to not be from one of these 20 counties, I promise you that the issues that we're talking about are really the same everywhere in the state and across the country. One thing that we know, whether you're in East Tennessee as I am or West Tennessee as you are, we're very fortunate to live in a state that has incredible natural beauty and a deep and rich culture and heritage. But we also live in a state that faces some significant health challenges. And that's really what I want to talk to you about today. So I'm going to pose and answer two questions today. What is the health status of West Tennessee? And what can be done to improve it? Now, to understand the health status of West Tennessee, or Tennessee as a whole, or any other geographic area, we have to have something to compare it to. So for purposes of today, I'm going to compare your 20 counties to the rest of the United States. And typically in public health, when we talk about the health of a nation, we use a statistic like life expectancy. It's the most basic fundamental measure of health. It reflects everything that goes into someone's life. If you think about it, how old is mom when she gets pregnant? Does mom use nicotine or alcohol or other addictive substances during pregnancy? Is the baby born in a safe environment? Does he have adequate food and clean water? Does he grow up in a country free from war and famine and civil strife? Can they get an education? Can they get a job? All of those things times 318 million makes up life expectancy in the United States. And if we went out on the streets anywhere in West Tennessee or in Nashville or here in East Tennessee, and we asked the man on the street to tell us something about life expectancy in the United States, he'd probably tell us two things. First, he'd say that life expectancy in the U.S. is probably the longest it's ever been. And here the man on the street would be right. In 2014, life expectancy in our country is almost 80 years. To give you a sense of how impressive that is, if you look at this chart, this goes back to 1900. From 1900 to 2000, so from the time that my grandparents were born to the time my youngest daughter was born, in that short amount of time, life expectancy in our country went up by 30 years. That's really impressive, and it's entirely consistent with what the man on the street thinks. The second thing the man on the street is likely to tell us about life expectancy is that it's probably the longest in the U.S. of anywhere in the world. The man on the street knows that we're one of the wealthiest countries in the world. We have an healthcare infrastructure unlike that anywhere else in the world. But here the man on the street would be wrong. Life expectancy in the United States is not the longest in the world. It's not even top 10. It's not top 20. It's not even top 30. In fact, in 2014, the United States ranked behind all of these countries, ranking about 33rd in the world. In other words, 2.5 dozen countries do better at this basic fundamental measure of health than does the United States. 2.5 dozen countries where a baby born today is projected to live a longer life than a baby born in the United States. And as challenging as that is for us, those of us who care about improving health, is even more challenging when we look at all 50 states, from Massachusetts with the lowest premature death rate, early death rate, to Mississippi with the highest. There's Tennessee all the way down there at 43rd. So here we are in the state that ranks 43rd in the nation that ranks 33rd in the world. Now, that's even more challenging for us, but it's especially difficult when you realize that the 20 counties of West Tennessee make up less than 10% of the state of Tennessee. So even looking at Tennessee as a whole doesn't really give you a picture of what your counties look like. So what we've done here at ETSU is we've taken the county health rankings for all 3,141 counties in America, and we've created a chart, a graph, that lays out all of these counties for their premature death rate. Along the left side of this chart is the premature death rate. That's your chance of dying young. The specific measure is years of potential life lost per 100,000 population, but don't worry about the number as much as the idea that a low number is good, a high number is bad. So on the left side of this chart are some counties with a premature mortality rate of below 4,000. On the right are some with premature mortality rates over 14,000. Low numbers are good, high numbers are bad. There's the U.S. average. There's Tennessee as the 43rd state in the nation. Now I'm going to put up the 20 counties of West Tennessee onto this map. Remember, low numbers are good, high numbers are bad, and there's your 20 counties. All but one are worse than the national average, and all but three are actually worse than the Tennessee average. So here you are in a region, West Tennessee, very similar to our region of East Tennessee, where most of your counties are worse than the state that ranks 43rd in the nation. So 85% of your counties have a premature mortality rate that's worse than the state that ranks 33rd in the nation that ranks 43rd in the nation that ranks 33rd in the world. So a few minutes ago, I posed the two what questions. At this point, I suspect most of you aren't asking what, but why? Why should someone born in West Tennessee or here in East Tennessee be more likely to live a shorter life than someone born in most other states and in dozens of other countries? Why do we have health statistics that are so much worse than we could achieve? And we know we could achieve them because other states are achieving them. And so certainly nothing that says that we can't be as successful as they are. This is not a rhetorical question. This is actually a question we can answer. Why should someone in West Tennessee be more likely to live a shorter life than someone born in most other states and in dozens of other countries? And the way we're going to answer this question is, once again, look at the health status of the United States. We're going to identify those things that cause Americans to die young. And then we're going to look and ask the question, which of those are worse in West Tennessee? Once you know what those things are, you know the things that you need to work on to improve health in your region. So there was an article in the New England Journal of Medicine a few years ago that identified 5 factors that cause Americans to die young. Now, these are not the 5 leading causes of death. We know that 2/3 of you, 2/3 of all of us on average, will die of heart disease, cancer, chronic obstructive pulmonary disease or smoker's lung, stroke, or unintentional injury. 2/3 of Americans will die of heart disease, cancer, stroke, chronic obstructive pulmonary disease, or accidents. But this is asking a different question, which are what are the factors that cause us to develop those diseases? And according to this article in the New England Journal of Medicine, those 5 factors are genetics. In other words, some of us die young because of what we inherit from our families. Environmental exposure, where we live. Social circumstance, the conditions in which we live. That leaves 2 wedges to this pie. And people are often surprised to learn that the smaller wedge is healthcare. What this means is that if all Americans had access to the very best healthcare, which they do not, we would reduce our early death rate by about 10%. Now, that's really important. And obviously, one of the challenges to improving health is to make sure that everyone has access to healthcare. But the reason I'm stressing this is because often community leaders assume that the only way to improve the health of their region is to have more healthcare, more doctors, more hospitals, more nurses, more clinics. And certainly that's often necessary, but it's not sufficient. And in fact, it pales in comparison to this other wedge in the pie that makes up 40%. Almost half of the reasons that we die young in our country are the behaviors that we engage in. Okay? So these are the things that cause Americans to die young. Let's ask the question, which of these explain why we're dying younger in Tennessee and especially in West Tennessee? So the first question is it genetics? Is there something about us genetically that's causing us to die young? And of course, there's no reason to think there is. Some people have suggested, well, if you look, for example, the distribution of Scots-Irish in America, we have a clustering here in Tennessee, and maybe there's something about us Scots-Irish that causes us to die young. There's no evidence for that. And in fact, there's a little interesting piece of evidence from this part of the state. It comes from this woman, Bess Brown Cooper. She was born in 1896 in Sullivan County. She graduated from East Tennessee State University in 1916, and for many years she was our oldest living alumna. We know that because for over a year, she was the world's oldest living person, not the oldest graduate of ETSU, not the oldest person from Tennessee, but one of only 8 people ever known to make it to the age of 116. And this proves absolutely nothing except to suggest that it probably isn't our genetics that's causing us to die young in the United States. Well, maybe it's healthcare. Maybe the reason we die young in Tennessee, and you guys in the West part die younger than the state average, is because of bad healthcare. Well, obviously, if you look at the health manpower shortage areas, you see them all around the country, and Tennessee is no exception. But if you really look behind the data, you see that this is a problem, but it doesn't explain the differences. So, for example, every year the county health rankings rank all 95 counties in Tennessee. One of the ways they measure it is clinical care. This is an outside group evaluating all the counties in Tennessee. And if you look at your 20 counties, you'll see that 13 of them, well over half, are actually in the top half for the state of Tennessee. So on average, by this metric, your region is actually slightly better off than the state of Tennessee. That's not to say that you don't need more health care, and in some cases better health care, and in some cases more access to health care. But I'm saying that this doesn't explain why there's a higher premature death rate in some parts of Tennessee, particularly in the West and in other parts. Well, what about this behaviors? Because obviously this is the issue that most of us think about. Well, according to the Centers for Disease Control, the factors that are actually causing us to die young, it won't be a surprise to you to learn that 18% of our early deaths are due to tobacco, about 15% due to obesity. The numbers drop off pretty quickly here, but they're still important. Alcohol, infectious diseases, toxic agents, pollutants, and so on. Motor vehicles, self-explanatory. Firearms, self-explanatory. Sexual behaviors that leads to AIDS and other diseases, and illicit drug use. These are the things the Centers for Disease Control says that we as Americans are dying from. Now, there's 2 really important messages for you all as community leaders on this list. The first message is that these problems can be solved. I want you to look at this list, and I guarantee, I don't know who's in the room there, but I guarantee in the next half hour, you all could get together and identify 2, 3, 4, 5 things that you know would make a difference for every single item up there. These are not insolvable problems. They can be solved. But there's a more important message on this list, and that is that these problems are more easily prevented than cured. Go back to this list for a second and ask yourself, what are the items up there that you could go to the doctor to be cured of? Well, maybe infectious diseases, maybe a few others. But by and large, these are things that have to be prevented. And again, this is an important message for you all, because this prevention, promoting health and preventing disease, is something that we can do at a community level. Public health is defined as what we as a society do to create the conditions for people to be healthy. And you all as community leaders can create those conditions. Right? So these are the things that the Centers for Disease Control says that Americans are dying from, causing us to die young. So the question is, which of these are worse in West Tennessee? So let's just look at the top 2. We know tobacco is a major leading preventable cause of death in our country. There's Tennessee all the way down there, ranked 46th. Here's all the counties in America. Low number is good, high number is bad. There's the national average. There's Tennessee at 46. And here are the 20 counties of West Tennessee. And you can see that 3/4 of your counties are actually worse than the state that ranks 46th in the nation. So clearly, one of the priority areas for you to improve health in your region is to put in place programs that will help kids not become smokers in the first place and will help current smokers. Well, what about obesity? We know that obesity, we're in the midst of about a 40-year epidemic of obesity in the United States. There's Tennessee all the way down there at number 47, the 4th worst state in the nation. Here's all the counties in America. Low numbers good, high numbers are bad. And if you look at this, by the way, it's pretty dramatic when you see that there are counties with less than 20% and other counties with over 40%. obesity in our country. There's the national average. There's Tennessee at 47. Here are the 20 counties of your region, and you can see that 85%, all but 3 of your counties, are actually worse than the state that ranks 47th in the nation. So again, advice to improve health: make sure you start putting in place programs that help educate kids to make intelligent choices about the food that they eat and the exercise that they get. And make sure that you explore ways with your local school system and others to encourage physical activity, not just competitive team sports, which involve only a subset of the students, but activities that involve as many students as possible. Now, this is where my talk would have ended 15 or 20 years ago. I would have said, look, folks, in West Tennessee, just like here in East Tennessee, we've got some challenges related to tobacco, related to obesity. Those are the big ticket items. If we want to impact health, we need to put in place programs at the community level that address those issues. But we've come to understand that there are a couple of other really important issues that you all as community leaders can deal with in West Tennessee. And it comes from this area that's called social circumstance, the conditions in which people live. So the logic goes something like this. We're born with a certain genetic predisposition to health. It's impacted by our ability to access health care. It's certainly impacted by our behaviors. But our health is also impacted significantly by the conditions in which we live, our early life experiences, the economy, and so on. Now, I'm not going to talk about all of these, but I just want to talk about 2 of them. The first being income, the relationship of poverty and poor health. So this is the distribution of children living in poverty in the United States. There's Tennessee all the way down there at 45, with over a quarter of our children living below the poverty line. This is all the counties in America. There's the national average. There's Tennessee at 45. Here are your 20 counties again, with all but 3 of them below the state rate. Now, this should matter to you for 2 reasons. First, because of the relationship of poverty and health. I could show you a lot of different slides to explain that relationship, but this next slide, I think, puts it all together. It's a pretty simple slide. It says, what's your chance of dying before the age of 65 based on your income? On the left side of this chart are wealthy Americans. On the right side are poor Americans. And what you can see is that the difference is about 3 times. So in other words, a poor American is almost 3 times, is actually over 3 times more likely to die before the age of 65 as a rich American. And what this means, of course, is that those parts of the country, like Tennessee, like West Tennessee, like East Tennessee, that have more people that are poor, are going to see higher death rates than those parts of the country that have more people that are wealthy. And suddenly it becomes obvious that those of us who care about improving health have to work with those folks who are trying to grow economies and create jobs, get people out of poverty. The second reason this statistic should matter to you is that the gap between rich and poor in our country is widening. These are data from the Census Bureau. This is 1973. It looks at the poorest fifth of Americans on the left and the richest fifth on the right. And in 1973, the gap, the ratio between the average income of the poorest fifth and the richest fifth was about 10 to 1. Now, I want to make the point that the richest fifth of Americans, we're not talking about the extremely wealthy. 1 out of every 5 people is in the top fifth and the bottom fifth. We're talking about the average Americans here, not the poorest, not the richest, but the average Americans. So that was 1973. 1983, not much change. 1993, the gap begins to widen. 2003, it's widened even more. And by 2013, over this 40-year period, the actual buying power of the poorest Americans has gone down slightly. At the same time, the buying power of the richest Americans has gone up, and the gap has widened 50%. Now, I don't put this up to make a political comment or an economic comment because I'm not a political or an economic person. I put it up to make a very important observation. And what this tells you is that those parts of the country, like West Tennessee, like East Tennessee, like Tennessee as a whole, with higher numbers of people who are in the poorest sections, are going to see widening economic gaps compared to states with wealthier people. And if you believe, as I do, that economics is tied to health, by definition, you're going to see widening health gap. And suddenly what that means is those of us who care about improving health have to work with the folks with economic development, because otherwise we won't get folks out of poverty and we won't narrow this gap. If we want to narrow the health gap, keep it from widening, we have to narrow the economic gap. And that means economic development. That means community development, job creation. So the only other one of these I want to talk about is education, again, because it's so important and because it's something that you all as community leaders can do. This is adults in the United States with some college. There's the national average. Tennessee's actually about at the national average. I'm going to put your 20 counties up. 100% of them fall below the national average, fall below the Tennessee average. This should matter to you for the same two reasons. First of all, it should matter to you because education is related to health. This is a simple chart that compares men and women, the age of 25, how many more years are they going to live? And what you can see is there's a significant difference if a man or a woman has less than a high school education compared to some college. Almost 5 to 7 years of difference. On average, a high school dropout will live 5 to 7 years less than a college graduate, and on average will make $1.1 million in lifetime income less. So if you know a kid who's thinking of dropping out of high school, maybe these numbers will help convince them to stay. The second reason this should matter to you is, again, just like economics, there's evidence that there's a widening educational gap and not a narrowing gap in our country. This is a chart that asks a simple question, which is how many high school sophomores will have a college degree in 10 years? How many high school sophomores will have a college degree in 10 years? If their parents are professional, 73, almost 3/4 of them will have a college degree in 10 years. If their parents are high school dropouts, less than 6%, a 12-fold difference in the chance of a kid getting a college degree based on their parents' educational level. What does this mean? This means that those parts of the country with lower educational achievement, those on the left side of this chart, are going to see widening educational gaps over time compared to those with more education. And if you believe, as I do, that education is related to health, you begin to realize that those parts of the country will also see widening health gaps unless we work together to get more kids through school, through high school, through community college, and through four-year universities. And all of a sudden, it becomes obvious that those of us who care about improving health have to start working with our colleagues in the educational sector to disrupt this trend. I could talk about this chart for a long time, but it really comes down to this one simple fact. If we want to improve health in West Tennessee or East Tennessee or the United States as a whole, we have to make sure that we have access to health care, including preventive services. We have to make sure that we work on changing kids' behaviors, but we also have to work on economic development and education. But the single most important point that I want to make is that none of these can be successful without the other two. Think about this. Every employer you know will tell you that they need a healthy, educated, drug-free workforce. Every school superintendent will tell you they need kids and parents and teachers that are healthy enough to come to school, but who also make the choices to come to school, but who also live in a community with a significant enough tax base to support the sort of innovative programs that help kids succeed in school. And every healthcare provider will tell you that they need patients and families that have the knowledge and the resources to invest in their health and the decision to go forward. So the key point in all of this is that no one of these can be successful without the other two. To put it into words, we need to work together to assure access to health care. We need to work together to encourage healthier behaviors. And we need to work together to enhance economic opportunity and improve educational achievement. And what these all have in common, of course, is we need to work together. No one of you in that room can do this alone. But if you work together, combine your economic development folks, your educational folks, your healthcare folks, your faith-based community, your business leaders, and others, you really can make a difference. Working together like this will make a difference in every part of the country, in every state in the nation. But I don't think it'll make a greater difference anywhere than it does in the state of Tennessee. Up in the upper right corner is my great-grandfather. He was a public health officer in Virginia 100 years ago. The upper left is my son Kevin, and the lower left is my family. My son Gregory is a RAF guide. And I close with this picture to remind me to say that nothing I've talked about really has anything to do with statistics or public health. It's really about whether or not you all, we all, as the leaders of our communities, will make the kind of decisions that we need to make to give our children and our grandchildren a region that is as healthy as it is beautiful. I want to thank you for allowing me to talk with you today, and especially I want to thank you for what you do. because I know that you will make a difference in the health of West Tennessee, and that will affect all of us in the state. So thank you very much, and good luck with the rest of your day.